Yeah. Rolling? All right. Okay. Well, that's great. So we're townies then.
Yeah.
So I'm right over there in, well, used to be Mercado Shores.
Okay.
So the apartment complex right back behind the Stula.
Mm-hmm.
That's where I'm headed. So.
Okay.
Yeah, I love it over there. It's a great little town. So.
Married to Gene Martin, but he passed away 8 years ago.
Say that again?
Eugene Martin.
Eugene, that was your husband?
Mm-hmm. Yeah, he passed away 8 years ago. Yeah.
I know that name.
Oh, he was the Osceola telephone repairman.
And that's why. I think he used to come out to the shop all the time. Because the lines out there are buggy.
Mm-hmm.
Always have been. Oh,
Yeah.
Small world, isn't it?
It sure is.
Well, I'll tell you what, Claudia, here's what I'm going to have you do. I'm going to have you say your first and last name, and then roll it.
Yeah.
Thank you. And spell it all the way through for me.
Spell it?
Yep. Say it and then spell it.
Okay. Claudia Martin. Claudia Martin.
Thank you.
Mm-hmm.
We just like to roll on that so we have it no matter what. So let's see. Tell me a little bit about Claudia. What brought you? What happened? What's this all about here? What are you doing?
What am I doing here? Well,
Start from the beginning. Don't hold anything back.
Okay. A couple years ago, I was experiencing a lot of low back pain, which I had for many, many years, but the pain started going down my legs, and I had actually I ended up with 5 different shots in the back, and it got so they didn't help. But I had been seeing Dr. Lozanecki for a couple of years, and we decided it was time for surgery, which I had July 12th this year.
Oh, so just over the summer.
Mm-hmm.
Just this past summer.
Mm-hmm. Yep.
So, well, obviously, if you're up and around,
Oh,
see you?
wonderful.
Yeah.
You did a wonderful, wonderful job.
Now I'm gonna have you. We're gonna walk around a little bit.
Okay.
We may cover the same territory more than once, but that's okay. You may answer a question a little bit different each time. So,
Mm-hmm.
Let's see. So, the theme through all the interviews that we're doing today is kind of choose unity.
Mm-hmm.
Like Unity Hospital, why people should come in.
Mm-hmm.
What brought you to you?
Well, when I discovered that my doctor had moved and I found out he was here at Unity, that's when I got a hold of him and continued to see him. That's how I ended up here at Unity. And then I had my surgery here, and it is fantastic. Wonderful.
Elaborate a little bit on that.
My room was like being in a high-class hotel. The food is wonderful, and if anybody comes in to visit you, they get fed. You have your choice of food, and it is really, really good. The nurses, the attendants here it's almost like one-on-one. A lot of attention. They treat you very special.
We've had more than one interviewee today talk. One lady said it was like a spa. The other lady said that it was almost like a vacation.
Mm-hmm.
So you're going to back them up on that.
Mm-hmm, absolutely. Yep.
Good. So so moving on that, how overall the people, how they treat you?
The people
Yeah.
here, oh, they treat me wonderful. They've all become friends, so to speak. Yeah.
That's fantastic.
Mhm.
Would it surprise you to know that Unity Medical has been voted number one in patient satisfaction?
That wouldn't surprise me at all.
What? Tell me a little bit. Why doesn't that surprise you?
Because you get a lot more attention, personal care, one-on-one, than you ever would in a hospital. If you turn your light on because you have a need, they are there. You're not waiting and waiting. They're very conscientious about your pain level. Make sure that you're not in pain. Make sure you're comfortable. Keep you moving. All the care is more than I've ever experienced in another hospital.
Oh, really?
Mhm.
Well, let's go back to that. Was there a moment? Can you think of any one particular thing where you were just kind of like, okay, this is not like a normal hospital?
Here?
Yeah. Like where all of a sudden you're like, aha, I've made a good, like this is way better than I'm used to. Anything you can remember?
Just the pleasantness of everybody, no matter if it's the nurse, the doctor, the cleaning lady, or somebody from the kitchen bringing your food or coming to see what you want. It was so different. The whole atmosphere is a happy atmosphere.
Well, and Unity is physician owned.
Yes.
Do you think how do you think that one affects the other? What's your opinion on that? What do you
It probably reflects on the physicians that own it. They wouldn't want to hear that their hospital wasn't treating patients right or bad care or something. So I think they make an effort to make it a place that people really, really want to be at if they have to be in the hospital. And the doctors here are excellent.
As far as your treatment goes, did you ever, was there ever a moment where you kind of thought, okay, they're really not letting any loose ends on, or you know what I mean? It's like they're really tracking this down. It's like they're going to find out. You ever get that impression? Like these guys were going over what you maybe would have thought they would have, or maybe that another hospital or another medical place did?
I think so, because when I had my pre-op testing, the different people that I talked to were very thorough. The pharmacist, the ones that were telling me about aftercare, just everything. Everything was covered completely.
We talked about that a little bit. As far as moving all the way up through from getting to know the pharmacist and getting to know how did you like that way, the way that they're doing it here?
I thought it was great.
Yeah.
They come to the room, have you in a regular patient room and come in, sit down on the couch. There's a couch in there, and just visit and
That's nice.
and they may even ask you, about your past and your family, and they're personal.
Yeah, and you mentioned that even if you had somebody visiting you, they'd say, well, what would you like to eat?
Right? Even when I was here for my pre-op testing,
Yeah.
they come in and wanted to know what I wanted to eat. And I said, I'm here for testing. And they said, that's okay. We feed everybody.
Oh, wow.
It was wonderful.
So did you have family over that got treated like that?
Mm-hmm. My daughter and my grandson. Yeah.
What did you hear back? Did they report on how that made them feel?
Oh, they felt very special. They couldn't believe it, that they were going to get fed, and then they could choose what they wanted and how good it was.
Heard a lot of good stuff about the food.
Oh, it's great. It is great.
Now let's talk about what do they need to do? What did you have done?
I had stenosis of the spine, so I believe he had to open up those canals where they were getting compressed going through the bone. He had to remove 3 herniated discs, fuse 3 vertebrae, and then Dr. Loznicki put in 2 rods and screws to support my spine. Mm-hmm.
And that was in July.
That was in July.
And I just noticed you strutting around the hallway.
I do fine. I'm back to doing just about everything I did before surgery.
Say that again.
I am back to doing almost everything I did before surgery.
Without any, is there pain now, or is there no pain, or what's the?
I might get a little ache if I try to do something. I did wear a brace around my back, but I moved furniture.
When you're moving furniture.
Yeah. I got a little backache.
Did you heard this?
Ask her about her dog.
Oh, my dog. He's still in the puppy stage. He's 15 months now. He's a Bernese Mountain Dog, and he's made it up to 109 pounds, and he's growing. And he is very affectionate, lovable, playful, ornery. When I first got home, I used a walker just for stability and everything. And if I had the walker there, he knew, stay down, stay away.
He knows.
But Oh, he still likes to climb in my lap and jump on me, and
The
yeah.
109-pound lap dog, is that what you got?
Yeah.
Oh, okay. Well, let me, one of the things that, one of our subjects today put it very, very succinctly. He was like, when I came in here, I was broken.
Mhm.
And he's like, and when I left, I was fixed.
Mhm. I agree with that.
How would you put that in your terms? I mean, how would you say that?
When I came in, the pain in the back and the legs really hindered doing things I wanted to do. It was hard to go up and down basement stairs, to vacuum, bend over, do any yard work. It was hard because I hurt and had to take pain medicine all the time and muscle relaxers. But then when I was released, I was on pain medicine and muscle relaxers, of course, for a while, but it wasn't long, and I was doing things I maybe shouldn't have been doing, but and it's to the point where I can do just about everything.
Yeah.
I mow my acre and a half of grass and
Oh,
bounce
my
along on my
goodness.
tractor, move furniture
Bounce
and
around,
vacuum,
probably, yeah.
rake leaves.
That's a lot more yard work than I do. And I don't like doing any of it. If you were to run into somebody that, maybe you overheard them, in a restaurant or just in a grocery store, it's like, oh, I got a back.
Mhm.
Maybe they're afraid. It's like, I gotta get it looked at, but I
Mhm.
know I'm gonna eat her. What would your, what would your recommendation of Unity? What would you tell them? What would it sound like?
I would tell them all about it, what a wonderful place it is. I would also tell them about my doctor, Dr. Lozinecki.
Yeah.
I think he's tops. And
What's so special about him? Let's go ahead and.
First of all, he's just a sweet guy.
Yeah.
Yeah. Very personable, friendly. He gets right to the point when he's checking you out and telling you what's going on, what's wrong, how it needs to be fixed. He leaves it up to you, to me, to decide when we're going to do it. Actually, I had different doctors that I have told me, oh, he is the best. His name has gotten around, and so that it really encouraged me. Yeah, I had no fear, no doubt that he could do it, and that he was the one to do it. And he fixed me. He told me I might hate him for a couple of weeks afterwards because of the pain. I think it was just the first few hours.
You did a fantastic. Anything that maybe we didn't talk about that you kind of had, that you had thought about that you wanted to mention?
I tried to get him to take my dog.
No dice, huh?
No. But
Well, yeah, I've got a
once I was feeling really, really good, I couldn't let him go.
No.
He's my baby.
Yeah, I have. Mm-hmm. I'm gonna have you say a couple things for me, just right up here,
Mhm.
real quick. Right up here, because choose unity. I want you to say that to me, just like you're saying it to, like telling me what to do.
Mhm.
Choose unity.
Choose unity.
One more time, please.
Choose unity.
Good. Slight variation. I chose unity.
I chose unity. I chose unity.
And then last one, this is the hard one. Get your life back. And complete with the pause and everything. Get your life back. Right?
Yeah, I want the emphasis on the word back, because
Yeah.
we're spine surgeon,
Mhm.
we're basically saying, by coming to Dr. Lozinecki, you get your life back.
Get your life back.
Okay.
Just like that.
Okay. Get your life back.
Okay, one more time.
Get your life back.
Good. Fantastic.
Yeah.
Is that painless or what?
No, painless.
Oh yeah. We do what we can.
Am I done?
We're
No.
gonna do a little interaction with.
Oh,
We want you to kind of
oh,
interact a little
okay.
bit. Maybe